Ever notice your gums pulling back from your teeth? Let's talk about the many reasons that may be happening. Hi, I'm Christie. I'm a registered dental hygienist and proud Burst ambassador, and you are watching Burst TV. Overzealous brushing and gum recession. So yeah, many of you have already caused gum damage from brushing too aggressively or brushing with hard or medium bristles. So let's tackle this one first. Brushing back and forth like this can cause gum tissue to wear down over time, making it thinner and thinner. Using hard or medium bristle toothbrushes can actually make this worse. Plaque is really very easy to remove. That's why us dental professionals recommend using soft or extra soft bristle toothbrushes. Plaque buildup is the main cause of gum recession, but nearly half of all cases are due to improper brushing technique. That's why brushing technique is just as important as the brushing itself. Now let's discuss teeth grinding and gum recession. Grinding, also known as bruxism, can put intense pressure on your teeth and gums, and this can lead to recession over time. Okay, so here's what happens. Constant clenching or grinding cause your gum tissue to pull away from your teeth. Many people actually clench or grind their teeth at night without even realizing it. So, we usually recommend a night guard, or sometimes called an occlusal guard, to put between your teeth to minimize the damage to your gums and your teeth while you're sleeping. There are also a few other instances where a guard may be helpful to help protect your teeth and your gums. Sometimes when people are working and they get really stressed and they clench their teeth, a guard may be helpful in this case. Or if you're a heavy weightlifter or you're working out at the gym and you realize you clench your teeth while you're doing it, a guard could also be helpful in that situation. All right, let's talk about misaligned teeth and gum recession. Crowded or misaligned teeth can cause uneven wear on your gums. Here's what happens. When you have crowded or misaligned teeth, or if you're missing teeth and your teeth start shifting, too much pressure and uneven force on your teeth and gums can cause localized recession. Orthodontics, such as clear aligners or braces, can help prevent long-term damage. If you're interested in something like this, we recommend talking to your dentist or seeing your local orthodontist. All right, so let's talk about gum disease, which is also called periodontitis, and gum recession. Gum disease destroys the gum tissue and supporting bone around the teeth. Plaque and tartar buildup, which tartar is also known in the dental world as calculus, lead to gum inflammation and therefore gum detachment. Untreated gum disease, such as periodontitis, can lead to gum recession, bone loss, and consequently, tooth loss. Studies have shown that nearly half of American adults have some sort of gum disease. If this is left untreated, it can create a whole systemic consequence, not only affecting your mouth, but your body as well. Studies have also shown a strong link between the severity of periodontal disease and the severity of recession. The more severe or more advanced the stages of your periodontal disease, the more recession spots will be in the mouth and the deeper the recession areas will be underneath your tooth. Okay, this is a hot topic and one that we tend to get a lot of pushback on in the dental world. Lip piercings, tongue piercings, and gum recession. Okay, so here's what happens. Oral piercings constantly rub against your gums, causing them to wear down. Constant friction equals gum recession, especially on the lower anterior teeth because your gums are already thinner there. Metal jewelry can chip teeth or irritate soft tissue. So if you're going to have an oral piercing or a lip piercing, try to switch to plastic instead of metal, and that will create less problems for the future. All right, hormonal changes and genetics. Some people are just genetically more prone to gum recession. Hormonal changes such as puberty, pregnancy, and menopause can weaken gum tissue. If you've ever been pregnant, you've probably heard your dentist talk about pregnancy gingivitis. So take extra care when you notice your gums bleeding a little more and ask for advice from your dentist or dental hygienist on how to best care for your gums during these times. And if you can, find out your family history. If your parents had gum recession, you may be genetically at a higher risk to have gum recession yourself. Dry mouth equals less protection from bacteria and acid, which can lead to gum recession and irritation. This can be common in many medication users, smokers, and mouth breathers. If this is an issue you're having a problem with, talk to your dental hygienist or your dentist for some tips on how to best manage xerostomia. So, if you're having an issue with gum recession or you notice some changes in your mouth, it's very important to make an appointment and go talk with your dental hygienist and dentist. Also, being sure that you go to regular cleaning and checkup can help you stay on top of dental recession and gum irritation. Thank you for watching. Like, comment below for any recession stories or questions. Hit subscribe, and thank you for watching Burst TV.